I'm Dr. Kotlar from the Chamber Center of Wellbeing. I'm the new chiropractor, and I'm here to talk about We've Got Your Back and all of the benefits and actually to teach you a little bit about what chiropractic is all about. So basically, I've been practicing for a long time. I've been a chiropractor for over 3 decades. I graduated from New York Chiropractic College, which is now the Northeast College of Health Sciences. And I have some specific certifications, a certified chiropractic sports physician by American Chiropractic Association, Council on Physical Fitness and Sports Injury Program. I have a background in functional movement technique, which involves using kinesiotaping and myofascial cupping, and also a specific technique called Cox flexion distraction, specifically for discogenic conditions, and that I was certified by National College of Chiropractic. Basically, over the years, my practices have always emphasized wellness, spinal health, of course, and posture. I always utilize therapeutic exercise. I do a little bit of nutrition involving specifically targeting bone, joint, and connective tissue health and adrenal support. I do have a program called Kotlar Chiro Stretch, which is a series of stretches as opposed to strengthening exercises, which target certain muscle groups that are related to low back pain and neck pain, which are primary areas that we treat. Of course, we treat full spine most of the time, so these exercises do cover overall spinal health. So basically, our goals for today are to understand chiropractic care. The term adjustment is a chiropractic term, and that involves correcting areas of the spine. What are the main goals of chiropractic care? Not just cracking, that's self-explanatory, we'll go into that. The many benefits of chiropractic and what to expect when you come in for a visit. So the word chiropractic actually means, chiro means hand, and practic, of course, practice by hand. So overall, that is what we do in this office. I primarily use an adjustment that is called Diversified Technique. So we do want to affect the mechanism of the vertebral joint. So, but what basically the word chiropractic means is that it's a alternative medicine focusing on the diagnosis and treatment of mechanical disorders of the musculoskeletal system without the use of drugs or surgery. So that's basically what the term means. And there are basically 26 movable segments in the spinal column, which includes 31 pairs of spinal nerves. They extend down from the brain down into the sacrum, which is the foundation of the spine, and exit through various openings within the spinal column. So the nerves leave through a complicated network, which influence all tissues of the body. Okay, here's a little quote from Gray's Anatomy that says the nervous system controls and coordinates all organs and structures of the human body. Misalignment of spinal vertebra and discs may cause irritation to the nervous system. So basically, we as chiropractors are realigning, or the alignment of the spinal vertebra is a very important part of our treatment. So we have various ways of measuring misalignment, and I'll go into that a little bit down the way. So here is a chart that's quite interesting. It's the vertebral subluxation and nerve chart. So the subluxation is basically when a bone is out of its normal position or alignment. So various areas contribute their innervation to parts of the bodies. For example, the atlas goes to the face and the brain and the ear. So adjusting certain vertebrae can perhaps affect these areas. Earaches notoriously can be affected by subluxation of the C1 vertebra. The same with the second axis. It can cause difficulty, or it can cause sinus symptoms. The special sensitive are affected by the upper cervicals. And as we go down the cervical spine, muscles are affected, of course. The area where there are transitions, such as C7 to T1, can affect shoulders and upper body. All the glands around that part of your spine can be affected with adjustment to those areas of your spine. So, and then we have the thoracic spine that goes to all of the organ systems, the heart, the liver, the stomach, the spleen, the adrenals are an area that I pay special attention to. And then the lumbar spine goes to all of the sexual organs. The lower legs, of course, are innervated by L3, L4, L5. The sciatic syndromes are all affected by lower ones. So this little chart kind of gives you an idea of how important the spine and all of its innervation are to the rest of the body. Okay, so the term adjustment is a chiropractic term. Okay, it is a manipulation, and sometimes we apply a high velocity impulse to the spine, but these are various techniques. But basically, we adjust the spine to remove any kind of nerve interference, and that's what our objective is. So we restore movement, we pay attention to realigning the spine, and we relieve pain, inflammation through spinal adjustment. Okay, so the same, so just to reiterate one more time here, many times with the adjustment, you do hear an audible click after the movement occurs, and that is just a release of, it's called cavitation, it's a release of pocket of air, and it's right around the joint capsule. The adjustment also brings back alignment when we do pelvic adjustments or sacroiliac adjustments, so we try to balance out the body through those adjustments. And one of our objectives with the adjustment is to bring the body beyond its normal range of motion, just slightly, and that's what releases that audible click. Many times this overstretching of the muscles that perhaps are in spasm can relieve inflammatory process associated with the subluxations. So our main goals are to reduce acute and chronic pain. Basically, acute, we want to reduce that inflammatory condition. We many times use some modalities to aid in that process. And when there is a chronic condition, ultimately we want to stop that condition from becoming a degenerative process, because the way the body puts Band-Aids on injuries is that there's an influx of calcium in these areas. And so the body tries to immobilize. So we believe that movement is medicine. And when we adjust, we move these areas with attempting not to cause any more further pain, and we can find those ways to stop that degenerative process, which usually follows any chronic situation. So we want to improve joint mobility, of course, ultimately function and health, aid in muscle, connective tissue, and nervous system recovery. Okay, so a lot of people walk in and they say, okay, I really don't want to be cracked, or I always tell them, we really don't crack anything. You can crack your knuckles and you can crack your knees, and some people actually can produce that audible release on their own. But the chiropractic adjustment basically is not meant to crack anything. It's meant to realign the spine And many times through that osseous adjustment, you do hear that audible click. So I think that it's really just an understanding of what really happens, and it should not be uncomfortable at all. And that's one of my objectives, make sure that it's comfortable and that your body's able to accept that. Okay, so there are many different techniques that we utilize in chiropractic, and I have experience in a number of them. Diversified Technique is the one that was basically from New York Chiropractic College, was taught. It's the traditional manipulation utilizing a high velocity, low amplitude thrust. So we do move the bones. It's a manual adjustment that places pressure on various parts of the vertebral segment, and we can do it with a direction or a line of drive to restore the proper movement and location of those bones. So there are many benefits of the chiropractic adjustment, but ultimately it's important to understand that we don't really cure any issues, but we do promote the body's self-healing properties. So the body has an innate intelligence, and it has the ability to heal itself, as long as it's guided in the right directions, that the bones are aligned, because when you are out of alignment and subluxated, many times the body puts pressure on different sides of the vertebra. You can develop curvatures of the spine, depending on what your habits are. Postural changes can put incredible strain on parts of the body. And so what our purpose is to realign those spinal joints so that your body can start to heal itself. Okay, what to expect when you come in for a chiropractic visit. So basically, you fill out an intake form just like you do when you go to any other medical doctor. The initial visit is a diagnostic, or I call it exploratory visit. So I do definitely a postural analysis. We do orthopedic testing and neurological testing. Basically, we want to see whether there's any reason not to adjust certain areas of the spine. So we make sure that we test all of these areas for ranges of motion. And of course, palpation is a big part of, or feeling what's happening paraspinally is an important part of the diagnostic visit. Then we have a second follow-up visit that includes a report of findings. And if there are radiological studies that need to be looked at, all of that is incorporated in the second report of findings visit. So we get the big picture on the second visit, but also on that very first visit, I do adjust the spine. So I look to see what moves and what doesn't move, and then I can determine a treatment plan, which I will discuss with every patient, see what works, and what will be most effective in reducing pain and inflammation if it's an acute situation, or if it's chronic, we can find a treatment plan to work with that. We also can refer you out for radiological studies, whether it be a X-ray of the spine or an MRI. Okay, so we also use various modalities here at the Chamber Center. We have a mechanism that's called mechanical intersegmental traction. It basically separates the spinal segments. It's due to come any day now. We do utilize EMS, or electrical muscle stimulation, which reduces edema, adhesions, muscle spasm, but also reduces pain in those areas, and it could be targeted with these 4 pads. I like to use also pulsed or therapeutic ultrasound. It penetrates a little bit deeper, and I can control it manually, and we can again target areas that are acute or chronic, it can be set to different levels. And if there are areas that have scar tissue or adhesions, this can affect those in the long run. We also, or I have chosen to use Sacral-Occipital Technique, or SOT, in the office, which involves placing these two blocks in a certain direction, so that is the sacral adjustment. We can put the patient into different categories and place these blocks in various positions, which can affect sciatica. It can affect increased lordosis, many other conditions. It's passive, and it uses the body's natural weight to begin that adjustment process. There also is a device that we use. It's a non-force device. It's called the activator. It's a spring, kind of a spring set instrument, and it is very soft, and it could be set to various levels. It's very soft and gentle. We could use this on children. We could use this on patients that are extremely sensitive, or areas that we don't want to adjust in a certain direction. So we can still get the effect on the nerve roots without going in directions that we don't want to. We can use that with rheumatoid patients, with osteoporotic patients. It's very versatile. And then we have also something called drop technique, or Thompson technique. It's a table that actually drops. It can be set a certain way and lifted, and then it absorbs the impact. So the patient perhaps hears a little bit of a sound, but the adjustment, we can align the drive in a certain direction, and we can use the table to aid with that adjustment. Okay, so that kind of is the wrap up. I just wanted to end with the doctor of the future will give no medicine, but will interest his patient in the care of the human frame, diet, and in the cause and prevention of disease. I believe this is our philosophy overall here at the Chambers Center in the chiropractic department. We kind of look at the whole body, and our objective is to improve your alignment and to decrease the amount of subluxation and insults that your body takes, and to improve your overall health. Okay, thanks for sharing this with us. And if you have any questions, please feel free to give us a call, and I would be happy to answer any of your questions. Okay, thank you.